Hi, my name is Trevor, and I'm the Chief Financial Officer at Constant Sorrows Hospital. It is my job to make sure the hospital earns a profit and pays dividends to its stockholders, and that the professionals and staff provide efficient, cost-effective care to our patients.
Hi, my name is Mary and I am a floor nurse at Constant Sorrows Hospital. My job is making sure that all our patients' needs are being met to the best of our ability. I am especially concerned that our patients feel cared for, nurtured, and comforted while they are with us.
Some of the nurses and doctors at Constant Sorrows Hospital do not understand how difficult my job is. Constant Sorrows Hospital is primarily a business. We exist to make a profit. Some patients can afford our services and some patients cannot. Patients who cannot afford our services should go to other facilities. We cannot afford to treat everyone. I'm doing my best to save Constant Sorrows Hospital.
Trevor was hired last year. I have been working at Constant Sorrows Hospital since I graduated from nursing school 5 years ago. Trevor is the fourth Chief Financial Officer at Constant Sorrows Hospital since I came here. Each time Constant Sorrows Hospital hires a new CFO, they come in saying they are not going to compromise care, but they all say they will cut costs, train staff, and make Constant Sorrows Hospital more efficient. Before they leave, they all create more problems than they solve, and in the end, they get replaced because the profits are not high enough for the stockholders.
Mary is a good example of the problems Constant Sorrows faces. She went to nursing school in a different age. Teachers in nursing schools do not understand how hospitals have to be run today. They teach their students that the costs of treating patients are not important. The most important thing about working in a hospital is understanding how to control excessive costs. It takes us 6 months to retrain new graduate nurses to work here because of all the nonsense they'll learn in nursing school. We would like to start our own nursing school right here at Constant Sorrows, so our nurses would know how to do their jobs from day one.
Sure, Trevor would love to have his own nursing school. When I started at Constant Sorrows, my orientation was focused on patient care. Now, when a new nurse is hired, the orientation focuses on paperwork, documentation, transfer policies, interfacing with insurers, and managed care organizations, and the clear messages: the faster patients are admitted and discharged, the better. Nobody seems to care if patients get better as long as the money keeps coming in.
Mary just doesn't understand how things work. Just last week I was able to negotiate a new contract with Real Greedy Managed Care. This contract will mean that Constant Sorrows won't have to make staffing cuts for the next 2 years, but we will need to become more efficient. We figure that we can keep our current staffing if we can move from 2 patients per ICU nurse to 5 patients per ICU nurse. Also, the medical surgical patient-to-nurse ratio will need to change from 8:1 to 12:1. But Mary and her friends refuse to work more efficiently.
We told Trevor 6 months ago that we could not increase patient-nurse ratios enough to meet the demands of that contract. Trevor and the board ignored what we told them. They went ahead and negotiated a contract that will increase stress among staff and jeopardize lives. Trevor should have held out for a higher reimbursement rate that would allow us to maintain current patient-nurse staffing ratios. This new contract is his fault, not the fault of nurses. We will be stuck with this contract when Trevor moves on to his next job.
Typical. Mary refuses to listen. We couldn't hold out. Constant Sorrows is losing money every day. Why? The depreciation on buildings alone resulted in an operating loss last year, and next year is going to be worse.
The last place Trevor worked failed a Joint Commission site visit 6 months after he left. The changes he made in staffing, procurement, and storage of equipment and supplies had devastating effects. 2 patients had wrong limb surgeries, 1 patient lost an arm, and 1 patient lost a leg. 3 patients died from medication errors that resulted from Trevor's new pharmacy procedures. The Joint Commission survey team cited egregious neglect of patients.
Typical nurse reaction. I was not responsible for those situations. The doctors and nurses were responsible. If they did their jobs right, none of those things would have occurred. I wasn't in the operating room and I didn't give any patients the wrong medications. Incompetent nurses and doctors harm those patients, not me.
Well now, I am a nurse. I think hospitals are here to care for the sick, aged, and frail. Hospitals are a community resource that should exist in a symbiotic relationship with the communities they serve. Patients, not profits, should be the primary concern. I am doing my best to save Constant Sorrows Hospital, but Trevor is the problem.
I'm an MBA and Chief Financial Officer. Hospitals, like any other business, exist to make profits for investors. Our investors are scattered all over the country. If Constant Sorrows can't make a profit for investors, then it should be closed. It is not the responsibility of our investors to meet the community's needs, it is the responsibility of the community to make sure that Constant Sorrows can operate at a profit. I'm doing my best to save Constant Sorrows Hospital, but Mary is the problem.